So orbital facial anthropometry implies that we are looking into the measurements of inner and outer canthal distance, palpebral fissure width, interpupillary distance, and calculating the canthal index. Pseudostrabismus is the appearance of strabismus in children. Actually, there is no true misalignment. This is quite often seen in children who have features like telecanthus, epicanthus, hypertelorism, and euroblepharon. These features can be present in isolation or in combination with various craniofacial or orbitofacial syndromes and congenital deformities and anomalies. So what's the importance of these measurements? It helps in diagnosis of craniofacial anomalies, orbitofacial syndromes and deformities, especially what we encounter is blepharophimosis syndrome, Apert syndrome and Clausen syndrome. It helps in management of these anomalies and deformities, especially so in reconstructive surgeries, also in lid reconstructive surgeries, so that it helps in better function and cosmesis, especially following trauma. Not alone that, it helps in genetic counseling of unaffected family members where there may be only manifest partial features. Other uses is in making of spectacle frames and lenses, optical display devices. Apart from ophthalmology, it is also useful in prosthodontics and forensic medicine in identifying of dead and living persons. Our aim was to analyze orbitofacial anthropometry in children with features of pseudostrabismus and to analyze these parameters in different age groups and between genders, and also to compare the measured and calculated IPD, that is MIPD and CIPD. This was a cross-sectional study and was done after obtaining Institutional Ethics Committee approval. Informed consent was taken from all parents of children. We recruited 60 children between 6 months and 18 years with features of pseudostrabismus, which I mentioned earlier. Children with lid and pupil abnormalities in whom measurements were not possible and with craniofacial orbitofacial deformities we excluded from the study. Also children with developmental delay were excluded. A simple instrument, that is digital vernier caliper, was used to measure all these parameters. 2 readings were taken by a single person. Canthal index, on the other hand, was calculated when we multiplied by 100 the ICD value divided by OCD. As early as 1983, Singh et al., one of the earliest pioneer in analyzing a regression formula for calculated IPD, he brought out this formula for male and female, which is as given below. So we use this formula to calculate the calculated IPD. There are other studies as well, foreign studies, but that was holding good for Western population. This is the only study available in India. Sub-age groups were less than 2 years, 3 to 5, 6 to 10, and greater than 10 years. Statistically, this data was analyzed. So as you can see, the central picture is showing to measure the IPD, the difficulty that we are having. But with the vernier caliper, when the child is sleeping, we can take the measurement much more conveniently. So there was male preponderance in our study, and the most common feature was telecanthus in 57%, followed by telecanthus with epicanthus, epicanthus in 10%, and hypertelorism in 2 children. When we compared the values between male and female, we found that all these parameters except calculated IPD was found to be statistically not significant between either sexes. We also had a subgroup analysis wherein when we compared between age groups, we found that all parameters except ICD and canthal index in male and female were found to be statistically significant. ICD did not have much change with growth. That means this ICD, inner canthal distance, it changed till the age of 3 to 5 years. After that, it remained almost constant. What varied was the outer canthal distance and the palpebral fissure width. When we compared between male and female, we found all the parameters were higher in male. But in children less than 2 years and greater than 10 years, we found that there was significant correlation between MIPD and CIPD in both male and female. More so in male, it correlated very well. So other studies analyzed in normative data, but we took up children with pseudostrabismus. There are no similar studies. Additionally, we compared MIPD and calculated IPD. Measuring IPD is very difficult in some children because of poor cooperation, low vision, nystagmus, developmental delay. Therefore, CIPD, which can be derived from using a simple caliper, measuring ICD and OCD, is much easier than measuring IPD in these children. This can be used for clinical purpose only if we have a good correlation. We found a significant positive correlation between the two. There are no similar studies comparing these two parameters. Like any other study, our study did have some limitations. It was not a longitudinal study. There were no equal numbers in sub-age groups, and it was not compared with normal children. So to conclude, orbitofacial anthropometry values in pseudostrabismic children, we presume that it will contribute to the normative data, helps in retaining ethnical features following lid or orbitofacial reconstructive surgeries, especially so following trauma, and it can be used to counsel parents during follow-up that the squint is pseudo and not true, especially in children with pseudostrabismus features and post-squint surgery when we can show these measurements. Calculated IPD can be a simple alternative for spectacle frame and lens making in children where measuring IPD is difficult. These are my references. Thank you.
You said that features of pseudostrabismus. So how you diagnose that it is a pseudostrabismus? Just
after whichever, according to the age group, we do the clinical evaluation
just
for alternate cover test
correct.
or Hirschberg test. If we rule out that there is no deviation or phoria, then we take those children into consideration. But they should be having one of these features.
Yes.
Number what was the duration of your study?
This is a cross-sectional study, sir.
And did you find any racial preponderance of pseudostrabismus?
Racial is that I just considered in and around my place, sir. So about probably 200 to 300 kilometers.
Okay, but
it's South India, sir.
It's okay, but in South
Southern
India also
India.
many people from other places also reside there. So did you find any particular